Good afternoon, ladies and gentlemen. It's my pleasure to introduce this afternoon's lecture, which is part of an ongoing series of events to mark the 250th anniversary of Clifton House, the home of Belfast Charitable Society. There's a few bits of housekeeping before we get into the business. There are no fire alarms planned today, but if one does happen to go off, which does happen occasionally in here, please just remain seated, and myself and James, who are the Clifton House staff here, will get you to where you need to go. For bathrooms, if anyone needs to use the bathroom during the lecture, you're just out the door and then right along the corridor, and you'll see those. And also, if I could ask you just to switch off or put on silent your mobile phones or devices, that would be really useful. We have a Zoom audience today, and for those of you joining us on Zoom, everyone will be muted upon entry, so I would ask that you remain muted throughout the lecture, and that will keep disruption to a minimum at this end, so thank you for that. Please ensure that your camera is switched off, and also you can use the chat function on your screen if you have any questions for Robyn, which we will take at the end, or if you have any difficulties in terms of the technology, just put anything in the chat function and we will do our best to pick those up at this end. And just a reminder to everyone in the room and on Zoom that today's lecture is being recorded. So we are delighted to welcome back to Clifton House today Dr Robyn Atcheson. Robyn is a social historian who specialises in poor relief and public health in early 19th century Belfast. She teaches and writes on social history, women's history, and the social history of medicine in Ireland and Britain from the early modern period to the 19th century. Robyn consults on public history projects and is currently working on a project about the Belfast workhouse and pauper burial grounds in Belfast. She has also contributed an excellent chapter to the most recent publication on the history of the Belfast Charitable Society, which marked its 270th anniversary just a couple of years ago. The first great charity of this time, the words of Henry Joy. And so in the absence of Sir Ronnie Weatherup, who would normally be chairing these events today, I'm going to channel his energies, because if anybody attends the events, you will know that he plugs this book every single time. So if you're watching Ronnie on the Zoom, you can get a copy of the book downstairs for £25 after the lecture on your way out. So the title of Robyn's talk today is Paupers and Public Health, Belfast Charitable Society and the Sick Poor. And so without further delay, I'd like to hand over to Robyn Atcheson.
Thank you. Thank you for coming along today, those of you in the room and those of you on Zoom as well. So as Jason says, I'm interested in poor relief and public health. So what life was like for ordinary people every day, and particularly how they accessed healthcare. It's difficult for us to understand now, but if we go back to when this poor house was originally built, healthcare was only for those who could afford to pay. You paid for a doctor to come to your house. They came to you, they treated you, you bought all the medicines, all the treatments directly from them, and then they would continue aftercare treatment with you. So if you were poor and you couldn't afford that, there was nowhere for you to go if you needed specialist medical advice. And whenever we get to the beginning of the 19th century, it's clear that Belfast, as it's starting its kind of growth period, is in desperate need for some kind of public health, some kind of system whereby people can actually access healthcare. The majority of the town's population live in really overcrowded, really cramped living conditions in houses that are not suitable. Several families often to one house. And as the town expands and more houses are being built, a lot of those houses are actually being built without any sanitation. So without any kind of clean water supply, access to water. So in those conditions, obviously, if there is disease, it's going to spread really quickly. So this is kind of the situation that we get to at the beginning of the 19th century. There are very limited access to infirmaries, which are like hospitals, and dispensaries, which are kind of like a GP surgery, like an outpatient advice. And those are based county by county. So Belfast straddles 2 counties, which means that the closest infirmary or dispensary is quite a way away if you're going into Antrim or if you're going into Down. So there is nothing really in the town itself. So into this comes the Belfast Charitable Society. And the Charitable Society, from its inception, wanted to fill this gap, wanted to provide for the poor people in all different ways of life, but particularly in healthcare. The Poor House itself opened in 1774, and an early meeting of the Charitable Society decided to put aside 10 beds for the sick poor. So physicians and surgeons of the town agreed to attend these patients for free, and they provided the Charitable Society with lists of necessary equipment that the house would need to be able to provide these services. By the time we get to 1775, they are now providing outpatient services as well. So for conditions that are less acute, that you don't need to actually stay within the infirmary, people can come to the house on particular days during set times. They can see a physician, they can get some advice, and they can get some medicines as well. So this is really the first healthcare that's freely available to the poor of Belfast. Now, in keeping with kind of the ethos of the 19th century, there are priorities given to certain categories of the poor. So particularly the resident poor. So Belfast is growing throughout the century, and that means that there's a lot of people coming into the town from elsewhere. They give priority, first of all, to people who've been resident in the town for a period of at least 1 year. And that means that they're trying to cut down on the possibility of people just coming in order to get the free healthcare and then leaving again. Now, there are exceptions to this, particularly accidents and anything that is particularly acute. So usually that means infectious diseases, where if they don't deal with it straight away, somebody might lose their life or disease might spread throughout the neighbourhood. The committee themselves quite happy to leave medical decisions up to the medical gentlemen who were part of the society and connected to it. So one of these examples is in the smallpox inoculation scheme. So in 1782, they agreed to introduce this scheme, which is kind of championed by Dr. William Drennan. And this is a very controversial way of combating smallpox. Now, I do have with me my bag of diseases. So smallpox. So these are cuddly diseases of what the microorganism looks like under a microscope, and then turned into a cuddly toy for people like me to collect. So this is our smallpox. Smallpox has a very long human history. We know that there are ancient Egyptian mummies who have smallpox scars, and it is a particularly deadly disease. So it is one of the most feared of the contagious diseases. And in a town where people are living in close quarters, it spreads very easily. In a place where you have a constant shift in terms of population, it means that you're seeing smallpox outbreaks more regularly. So in rural environments, smallpox comes and goes about once a generation. So it'll appear, many people will get ill with it. Those that survive have immunity and the disease leaves. It comes back around 20 years later in rural areas. In urban areas, in places like Belfast, it can appear every 3 to 5 years. So this is kind of a constant issue that anybody looking to service the public health of the town has to come to terms with. So the Poor House decide that they're going to champion this new idea of inoculation. I say new, it's new to the Western world. And it's basically the idea that you give a patient a weak form of smallpox. So you make an incision in their arm, you open up a wound, and you put into that incision usually the dried scabs of someone who had had smallpox, and you rub it in, make sure it really gets into the blood supply, and that person then gets smallpox, but in a controlled way. It's controversial because the mortality rate is pretty much the same as if you just caught smallpox naturally. About 30% of people who do catch it do die. So this is controversial. The Poorhouse allowed Dr. Drennan to carry out this plan. Then at the turn of the century, they actually go a step further and they agree to trying out this new thing called vaccination, which has been discovered by Dr. Edward Jenner over in England. And this is where you actually don't use smallpox scabs, you're using cowpox, which is a much milder disease. It has a much higher survivability rate, and it provides you with immunity from smallpox. So you'll see in this diagram from the 19th century that the arms that are on the left are those who are treated with inoculation of live smallpox, and the arms on the right are those of people who've been given cowpox instead, the 12th day at the top and the 13th day after being exposed. So this is groundbreaking, but it's not without its challenges for the people involved, particularly if we take into account that the poor who are being subject to these inoculations and later vaccinations often don't really have any say in what's happening to them. There's no kind of informed consent happening. If we look at the committee of the charitable society, the men who are making the decisions, there's pretty much always a steady presence of a medical gentleman, a physician or a surgeon. So if we go up to the first 40 years of the 19th century, about 100 or so men sit on this committee, and 8 of them have medical training, and their tenures are quite evenly spread out. So there's a constant input of medical advice. A tribute poem that's published in 1806 about the Poorhouse includes this verse about the particular healthcare aspect of it. Those to whom sickness had made thin the face might there find comfort and a resting place. Those sore diseased and those with broken bones, whose days were passed in sighs and mournful groans, the skilled physicians might attend them there with healing medicine and needful care. So this sounds idyllic, that there's this enlightened place where the poor can go to get free healthcare. And we know that medical knowledge is here in the Poorhouse and in its day-to-day operation, but that medical knowledge is not actually that advanced. So there are issues in the Poorhouse to do with sanitation, to do with health, and the kind of science behind that is still very much being teased out in the beginning of the 19th century. So the people who are actually championing the cleanliness of the house, making sure that things are as clean as possible, and that there is fresh water and hygiene is being maintained, are not the medical men who are giving advice to the Charitable Society Committee. These medical men at this point in time wouldn't have washed their hands, wouldn't have washed their instruments. They would have considered that to be insulting if you suggested that they should wash their hands. So they're not the ones that are saying we need the Poorhouse to be clean. The people who are actually saying that are the Ladies Committee. So the Ladies Committee is being had set up originally in 1814, spent a frustrating 2 years making suggestions to the men, and when those suggestions were continually ignored, the ladies just gave up. But about a decade or so later, 1827, they come back and they're reformed, they're much more active, and they're very vigorous in constantly demanding that the cleanliness levels in the Poorhouse be maintained. So they visit the Poorhouse daily, they request more and more soap, they try to get the men to take the vermin problem seriously, which suggests that they hadn't been up until that point. And they also ask for permission to supervise the hygiene of the girls living in the house particularly, especially in combing their hair, which suggests to us that lice was probably an issue as well. So from these snippets in the Ladies Committee records, we can see that some of the circumstances within the house for the poor who were actually resident in the Poorhouse were causing issues. Lice was referenced quite frequently, as well as scrofula, which was a skin infection, also known as the King's Evil. So it was also something that came up quite regularly. And the ladies noted in 1838, notwithstanding the little attention that is in general paid to the suggestions of the ladies, they consider it their duty to persevere. So even though sometimes they're banging their head against the wall, they keep going. And as this is really the only place where the poor can come for free healthcare, we do get a glimpse into what kind of things people are having issues with at the beginning of the century. A big one is industrial accidents. So this is when the mills and the factories of Belfast are starting to prosper. With those kind of innovations and with that progress comes accidents that happen to the working classes who are working in these places. So particularly we have records of amputations having to be carried out. Now this photograph is of a 19th century amputation kit. You'll see that some of the velvet lining is a bit stained because they don't wash their instruments and they don't wash their hands, so that is blood. And this is actually on display downstairs if you want to go and have a look at some of these things close up. We know that there are some people who come into the workhouse straight away after an accident. So, for example, a man called John Kinley comes in August 1805. He had a work accident in a flax mill and has to have his arm amputated straight away. Then there are other people, like a man called Charles O'Neill, who is admitted in August of 1806 and remains in the infirmary until December, when they make the decision to amputate his leg. So that suggests that there was a period where they thought maybe they would be able to save it. There is nowhere else for people to go for kind of accidents and emergencies like this at the beginning of the century. The poorhouse is really the only place where they can go. Day to day, most of the kind of more chronic conditions that we see are related directly to poverty that people are living in. So there's a lot of skin complaints, a lot of sores, ulcers. We also see things like asthma from living in kind of poorly ventilated and poorly sanitized areas of the town. And we see things like diarrhea and bloody flux, which is just a bloody form of diarrhea. I don't have a cuddly toy to represent that. But these are the things that people are coming to the poorhouse to get help with. We also see some records about people with disabilities. There's nowhere for people who have chronic health conditions or permanent disabilities to go. We do know that they come into contact with the poorhouse. On occasion, it's because they've been essentially arrested for begging on the street and the constables bring them to the poorhouse. We know that some disabled individuals are admitted to the poorhouse, and usually if they are admitted, there's a note made beside them that they are of decent character. Which kind of illustrates that at the turn of the century, there's still this idea, this kind of old prejudice that an outward disability means that there's some inward moral flaw within your character. So for a long time, sin and disability were considered connected. And it shows us that by saying this person is disabled but has a decent character, the committee are still kind of showing some of those old prejudices. We can see this in particular the men's committee. The ladies committee asked them to hire a young girl to teach the infant school, who is recorded as being lame. And the men take some time to consider this, and they come back and say that she can be appointed. Her name's Mary Kelly. But instead of paying her a salary, they grant her a bonnet and a cloak that's wide enough to cover her crutch. So she can work, but we're not going to pay her, and she has to hide the fact that she has a disability. So there are some enlightened principles happening within the poorhouse, but there's still these old prejudices that are still in the background. So for about 20 years, the poorhouse is the only place to get any kind of medical care if you're poor. And then we get a dispensary that's set up in 1792. And this really comes directly out of the work of the poorhouse. So the outpatient advice clinics that were being run in the poorhouse are considered to be such a vital work among the poor that they want to set this up as its own distinct organisation. So one of the main reasons that they have for this, that they're using to try and get people to donate to this, because it's going to be completely run off charitable donations, is that if you reduce sickness among the poor, the number of beggars that you see on the street will decrease too. So it's not purely altruistic. They're also wanting to kind of clean up the streets a little bit. Begging on the streets was considered to be a kind of stain on an enlightened society. There was also a lot of emphasis put on sickness being the reason why people weren't working, and getting people into work was considered very important. So the dispensary opened in 1792. It focused on free access to physicians for outpatient advice and smallpox inoculations as well. Other original aims that they had wanted to include but were just not able to because of funding and things were providing for poor women in childbirth, providing apparatus to resuscitate drowned people as well, which they didn't quite get to. They also wanted to provide for infectious diseases specifically. So infectious disease was a frequent reality of life. There's constantly an outbreak of something or other. It tends to start in the poorer parts of town and spread throughout the rest of society. So outbreaks of fever, which is kind of a catch-all term, usually means typhus, were very common by the end of the 18th century. So Belfast wants to do something about this, and it resolves to do this in the form of a fever hospital. So there's a lot of people coming and going through Belfast, through the port, through international travel. And they know enough at this point in time to know that it's better to quarantine people who have an infectious disease to keep it from spreading. So having a building where you can send people so that it doesn't spread throughout society is considered the best option. So they opened the first fever hospital in 1797. It's funded partly by donations and partly by government, but it tends to suffer when public interest wanes. So whenever there is an outbreak of something, people are giving money towards the fever hospital. Whenever there isn't an outbreak of anything, people don't really care. It's not really an issue for them anymore. As the town grows, they decide that they want to build a purpose-built fever hospital. There's an outbreak of typhus in 1816, and that really spurs on the erection of the permanent fever hospital in Frederick Street, which is what this image is of, in 1817. So it focuses on infectious disease. If there's room, it does take on general medical and surgical cases. It works in tandem with the dispensary to also provide outpatient services and inoculation. It's closely connected to the Charitable Society. So about half of those who sit on the managing committee of the Fever Hospital are also involved in the committee of the Charitable Society. They provide medicines for the poor house, and the poor house can send people to the Fever Hospital if they have something infectious. So there's a good working relationship there. When there is an outbreak of fever and the hospital needs as much space as possible, the poor house agrees to take patients who have other diseases into poor house, people who are still recovering in the convalescent stage. But they do have one condition, which is that they won't take any venereal patients. And the hospital does have a lock ward, which is the term for essentially a locked ward where you put people who have a venereal disease. So venereal diseases, as she goes back into her bag, we're really talking about this, which is my favourite historical disease. This is syphilis. And syphilis is the primary venereal disease in the 19th century, although we do have gonorrhea as well. But syphilis was considered to be a marker of an immoral society. So if you had syphilis, if you acknowledged that people in the town were struggling with syphilis, then you were acknowledging that there was immorality in your town. So you lock them away out of sight. If you needed medical help for syphilis, you were considered undeserving because you'd brought it on yourself through your immoral behaviour. So as the town of Belfast grows, this hospital becomes more and more important in terms of being a place where people can go for help with infectious diseases. There is a fear, obviously, because a lot of people go to this hospital and never leave again. There we go. As the town grows, the fever hospital and dispensary expand their remit a little bit. So the hospital itself is in charge of the building and what's going on in the building. The dispensary is in charge of what's going on in the rest of the town. And it divides the town into 6 medical districts and has 1 medical attendant in charge of each district. So what that means is that if there is an outbreak of disease, they'll know about it pretty quickly. So this is the first option aside from the poorhouse, but there are kind of groups of the sick poor that aren't being catered for in the fever hospital. So the first group I want to talk about are the lunatics. So for the first few decades of the 19th century, if you don't have an infectious disease, the only place that you can really turn to is the poorhouse. And there is no help for poor people who have any of the conditions that are termed as lunacy at this period. So we're talking about mental health conditions, but we're also talking about things like learning difficulties, dementia, a lot of people who have syphilis. If it reaches tertiary level syphilis, it can affect the nervous system and the brain, which leads to a condition called general paralysis of the insane. So a lot of people who are termed lunatics are actually suffering from 3rd level syphilis. But also people who have epilepsy are considered to be lunatics as well. So mad women are referred to for the first time in the poorhouse minute books in the 1780s, and then the first one is admitted in 1791. Now, these lunatics are usually separated from the rest of the poorhouse population. So from 1810 to 1814, just to give you a sample, there are 21 lunatics who are named in the records. Most of them are confined to a particular part of the poorhouse. Usually that's a cell or in the spire itself. So they're kept apart. 2 of the people that are named out of this 21-person sample are recorded as being chained and handcuffed, which means that they were quite dangerous and quite unruly, and this was the only way to try and contain them. For those who were too unruly for the poorhouse to deal with, they do arrange departures. So about once a year, they get a group of lunatics together and they send them to Dublin. So the Dublin House of Industry is a kind of bigger version of a poorhouse that has a lot of different wings and a lot of different annexes to it. One of them deals specifically with lunatics. It eventually becomes the Richmond Lunatic Asylum. But the poorhouse sends 5-6 people a year down to Dublin to be cared for in this kind of more specialist institution. We can tell from the records that sometimes these individuals don't have any choice in the matter. And we know this because there's one record of a widow who deliberately leaves the poorhouse with her daughter, who is recorded as being an idiot, because she doesn't want her daughter to be sent to Dublin. So that leads us to believe that they probably don't have much of a say in this. But this is becoming so much of an issue for the poorhouse and for other institutions in Belfast, what to do with poor lunatics, that they arrange a deputation to the Lord Lieutenant to apply for an official lunatic asylum for Belfast in 1818. This doesn't really go anywhere, so a few years later in 1825, they ask again. They have people with them from the fever hospital, from other institutions in the town that deal with the poor, and they say this is a serious problem, we need to have a solution for it. This leads to the Belfast District Lunatic Asylum being opened in 1829. So this is part of a national system of lunatic asylums, and its focus is on moral treatment. So that means no restraints, a kind of individual holistic treatment that's really determined on rest, support, comfort. So the Belfast Lunatic Asylum was built on the Grosvenor Road, which is now where part of the Royal Victoria Hospital stands. Another group of people that don't really come into contact very much with the poorhouse and are a little bit forgotten about are women in childbirth. So if you had money and you were pregnant, you were worried about childbirth, you could pay for a midwife to come and attend you. or you could pay for a male physician to come. So these are sometimes called man midwives or accoucheurs, and they can come and help you in the childbirth chamber. There's also a private maternity home in Belfast that's run by a professor, where you can go and stay there outside of your own home. If you don't have money, you're really relying on members of your own family, neighbours, members of your community who don't have any medical training or any experience in it. So it is a dangerous position to be in. Unlike other places in Britain and Ireland, Belfast sets up a maternity hospital called the Lion Inn Hospital then. And in most other places, these are set up by a doctor who's particularly interested in obstetrics. In Belfast, it's actually set up by middle-class women. So a group of women come together in 1793. They recognise that this is an issue in Belfast. There's nowhere for poor women to go if they're having trouble with childbirth. So they set up the Belfast Lion Inn Hospital in 1794. Initially, they just rent a house with a few beds. They have a midwife on staff, and they have the doctors of the town are available to come in to help for free if a birth gets particularly dangerous. They also provide clothes for the women and the children. They provide education for young girls, and they provide outpatient treatment in the homes of the poor themselves. And this is all funded through voluntary donations. In 1830, they've outgrown this little house that they're renting, and they move into this building on Clifton Street, which was on land owned by the Charitable Society. So initially in the 1790s, when these women were setting out, they had wanted to do so on land owned by the Charitable Society, and the Society had rejected these requests. But by 1830, the hospital had proved itself that this was a need for the town, and they do decide to grant them the land, but they still want to keep a bit of distance from this institution. And the relationship between the Charitable Society and the Lion Inn Hospital is quite strained, pretty much until the hospital moves away from this site and moves to Townsend Street in 1904. The Society does provide free water to the hospital. It buries the dead, anybody who dies in the Lion Inn Hospital, but these are kind of overshadowed by disputes about whether they should be paying rent for this land or not. Many of the women involved in running the Lion Inn Hospital are actually related to the men who are making the decisions in the Charitable Society. So that must have been quite interesting behind closed doors. And there is a network of women who are involved in the Ladies' Committee of the Poor House, in the Lion Inn Hospital, and in other organisations in the town who are a bit more hidden. They're a bit more behind the scenes, which is one area of Belfast's history that's waiting to be teased out a little bit more. Now, other than the fact that this is run by women, which is quite remarkable, the other thing about this hospital which makes it quite different to other maternity hospitals of the time is that it has very low rates of maternal mortality. So there are statistics that are collected in the 1850s that show the maternal mortality rate is 2.9 per 1,000 births. Now, if we compare this with Dublin, which has 2 maternity hospitals, around the same period, those have mortality rates of 21 per 1,000 births and 10 per 1,000 births. So Belfast is quite low. The Glasgow Maternity Hospital has a rate of about 12. So was it that the ladies themselves were having an impact on this? If these are the same ladies who are connected to the poor house who have such an emphasis on cleanliness, is that why this hospital has lower maternal mortality rates? Because they are insisting that things be clean, that people wash their hands, that people wash their instruments. And the instruments they would have used would be things like this. This is a set of forceps from the 19th century, which you can also see downstairs as well. Were they making sure that instruments like this were being washed? And is that the simple reason why the mortality rate is so low? They do rely on a midwife for most of the births, and I'm just going to show you one of my pet passions, which is that I collect birthing stools from the 19th century. So these are 4 of my birthing stools. I have 5 at the minute. One of them is downstairs as well that you can have a wee look at. And these are used for midwife births. So you can take them apart, the legs unscrew, and a midwife would carry this with her to different births. When you're in the hospital, you're much more likely to be lying down, because if you're lying down and not sitting up, it's easier for them to use instruments like forceps. So I just like showing off my birthing skills just whenever I can. So we've had a series of different hospitals set up for specific groups of the poor. And this has led to a kind of informal network of different charities and institutions that are dealing with different parts of public health. We add into this that there's some specialist dispensaries that are formed that only deal with, for example, eye cases. They only deal with diseases of the skin. And that's because those are kind of pet passions for particular doctors. So they set up a clinic where they just deal with those issues. And this leads us to a situation where we have this medical network, which starts at 12 o'clock in this diagram with the infirmary of the poorhouse. And over time, more and more things are being added into this. So we have the Lying-in Hospital, the Fever Hospital and Dispensary, the Destitute Sick Society, which is an organisation that visits the poor in their own homes and just helps them improve the general healthiness that they're living in. So it gives them food, gives them blankets, gives them coal. We have the Chapel Lane Dispensary, one of those specialist dispensaries that I mentioned, and then we have the Lunatic Asylum. So there's this medical network that is drawing from a very small group of middle-class men and women in society who are all connected to each other. So we have this network that is trundling along whenever things are going well. But how does it react whenever there is a crisis, whenever there is an outbreak? And the first test that this network has is in 1816 with this outbreak of fever. There's typhus and relapsing fever. So two different kinds of infections are on the rise in society. The winter of 1816 had been very cold, very wet. We wouldn't know what that's like, obviously. But that had ruined the harvest, which meant that the poor didn't have as much to eat, which meant they were more vulnerable to disease. It spread in Belfast from around November 1816 to February 1819. And contemporary statistics estimated that it affected nearly 20% of the population. Now, that's not a mortality rate, that's just who got sick. And all of these different organisations work together to try and stem this. Then this is put to the test even more so in 1832, when there is a global pandemic of cholera hitting Europe for the first time. So one of the doctors in Belfast, Dr. Henry McCormick, wrote, "The progress of the disease in other places had given us sufficient warning and enabled us to arm for its approach." I almost forgot to show you cholera. So cholera is, we now know, a waterborne disease, but they don't know this in the first half of the 19th century. And it is typified by excessive diarrhea, which leads to dehydration. And if you're poor, if your body is not developed with a strong immune system, you're going to succumb to it very quickly. And that's one of the terrifying things about cholera, that it can kill within 24 hours of first showing symptoms. So there's a slow progress of the disease across Europe, and Belfast is aware that it is going to come to Belfast. So they make preparations. A board of health is established to try and organise this response. They build an extra building at the back of the Frederick Street Fever Hospital that's just going to be for cholera patients in February 1832. And the first case appears on the 29th of February that year. And this is a cooper, a man from Belfast, who dies 19 hours after first showing symptoms. And the plans are immediately put into place. So they quarantine his family, they burn his clothes, they fumigate and whitewash his house, and they kind of develop an early form of track and trace, whereby they're able to track some of the early victims. We know from statistics put together by a doctor at the time that these red areas on the map are where cholera hits the most. And that little triangle of red is the poorest part of the town around Smithfield. So this is where more cholera deaths are recorded. And then we have this other big long red section, which is where a lot of other cholera deaths are recorded. So it does strike more in poor areas because of the issues with sanitation. The poorhouse, it goes into lockdown pretty much as soon as this first victim is identified. It does help in the public health effort. So it supplies coffins, it conveys patients to and from the cholera hospital. It also opens up its common ground for use as a cholera pit to bury the victims. Doctors associated with the poorhouse advise that the residents of the poorhouse be fed a better diet to kind of build up their systems. So they're given a meat broth instead of just vegetables. And anyone who leaves the poorhouse for any reason has to go into isolation before they're allowed back in again. So one of the surgeons noted that the poorhouse did so well in this kind of lockdown that it was one of the few institutions that remained cholera-free, and the health of the paupers inside actually improved during the period. Another committee member who was a minister also noted that the morals of the residents improved during this period as well, because they weren't able to leave to get access to alcohol and things like that, although tobacco was brought to them. It does manage to escape cholera. It survives the peak, which is in July, until October of 1832, when a gravedigger brings the first case of cholera into the house, and then it does have 4 deaths. So Dr. McCormick, the physician of the cholera hospital, he collated mortality rates based on cholera hospitals and estimated that Belfast actually did very well compared to towns and cities across Ireland and Britain. And this seems to be very, very good. The physicians of Belfast are very proud of their efforts. But these figures only come from the hospitals. They don't come from people who die at home, people who never make it to hospital, or people who are paying to be treated privately as well. So this epidemic shows that the network that Belfast had built was working, but it was being tested. Then we get to the workhouse. So the Belfast workhouse opens in 1841, and as under law, it opens with an infirmary for people who are sick within the workhouse. There's a fever outbreak in 1843, and this is uncharted territory for the guardians who are managing the workhouse. They don't know what to do with this, so they turn to this pre-existing public health network and they ask them for advice. They ask the fever hospital to tell them what to do, essentially, and they step up as part of this network. But there are issues with that because nobody is in full control. And then the law changes in 1843. The guardians now have responsibility for infectious disease, and this leads to a whole shake-up of the system. So the Frederick Street Hospital is no longer responsible for infectious disease. It turns itself into a general hospital. The workhouse builds its own fever hospital, the Union Fever Hospital, which is the only part of the workhouse that still stands to this day at the back of the city hospital. 1847 is when these changes occur, and this is when we start to see famine, fever, typhus hit Belfast. This time, the network comes together, but the workhouse is in charge. It's the workhouse guardians who are kind of have the final say, have the authority. They then also have to step in whenever things happen, like the general hospital decide to close their lock wards. They're not going to take any syphilis patients anymore. The workhouse has to take them. And this really leads to the workhouse having to take on more and more responsibilities. So the following year, cholera comes back, appears in the workhouse. The town is pretty much divided down the middle. This is how they decide to deal with it. So if you live on one side of the line, you go to the Union Hospital at the workhouse. If you live on the other side of the line, you go to the Frederick Street Hospital. And this is how they respond to that. So the Board of Guardians is in the middle. They're making the decisions. They have the 2 hospitals at their disposal. They have the College Hospital, which is where medical students had been trained up at Inst. They have the cholera buildings that have been disused since the last outbreak. They also use vacant houses to act as watch stations, and they erect sheds and canvas tents because this is the biggest outbreak that Belfast has seen. So after the famine then, just to finish, after the crisis of the famine years, the general hospital is able to branch out a little bit. It's no longer focused just on infectious disease. It focuses on surgery. It develops more techniques in surgery. It starts to receive attempted suicide patients and dabble in kind of mental health care. It starts performing operations under chloroform and then exploring anesthetics. This is an apparatus for administering ether per rectum. So you can fill in the blanks there. The union guardians at the workhouse, their responsibility keeps expanding. Now they're in charge, after the famine, of dispensaries as well. They're in charge of outpatient treatment. Then workhouse hospitals become open to everyone, not just residents of the workhouse. So this is an attempt to remove some of the stigma of having to go to the workhouse for help. But this essentially means that the public health network is all centered around the workhouse. What that means is we then see a lot of other hospitals spring up that are just looking at specific parts of the body. And this is the time when specialisation in medicine really takes off. So there's actually loads of hospitals that are built in Belfast towards the end of the 19th century that are all for specific things. So we have the Hospital for Diseases of the Skin, the Ulster Eye, Ear and Throat Hospital, and the Samaritan Hospital. These are all linked to the Charitable Society through the benefactor of these, Edward Benn. We have the Ophthalmic Institution, several hospitals for sick children. We have the Mater Inforium, which is the only one that's more general, which opens in 1883 by the Sisters of Mercy. The Claremont Street Hospital, so I'm just going to double check, is the third hospital in Britain and Ireland specifically for neurological diseases. And then we get a glimpse at what the early 20th century has in store. The Forster Green Hospital opens for consumption and chest diseases. So this is really the period where TB becomes the most feared disease. I'm not going to go into my bag because TB is very small and I probably won't find it. But this is a hint of what's to come. The poorhouse then, what happens to it? Its medical role has vastly changed by the end of the 19th century. It was once the pioneer, the kind of starting off point for this medical health network. By the time we get to the second half of the century, these public health responsibilities are now located with other bodies, with the workhouse guardians, with the new and improved Belfast Corporation. The poorhouse itself doesn't have to take on these duties anymore. So it now just focuses on looking after the medical needs of the people within the poorhouse. It becomes much more focused on things like nursing as a profession and on helping particularly the elderly who are making up more and more of the population of the poorhouse. So this takes us up to the end of the century, whenever the poorhouse's role in public health, in caring for the sick poor, has vastly changed. So thank you very much.